All right, interesting intersection with the tax cuts and this next story. Concern of state spending, of course, is always a concern. Yes, Medicaid is now in the crosshairs for conservative lawmakers. They say if Medicaid costs aren't proactively reined in, it's going to compromise the budget, which, depending on what passes this year, could already be compromised. Who knows? Education, transportation, public safety, you name it, it's all on that list. It could all be at risk if Medicaid spending goes too far, they say. Well, they tried it once already this session. But House Bill 138, after barely passing the House 2 weeks ago, seems to be dead now in a Senate committee. But now another watered-down version just cleared the House Health and Welfare Committee. Critics call House Bill 345, and yes, we've had 345 or more already proposed in the House side. They call it an attempt to take medical care away from people who need it most by, well, burying them in paperwork. Here's Joe Paris.
There's a lot of opinions on the word compromise in politics, but it does appear to be a central theme of a new Medicaid cost containment proposal.
I think that we heard a lot of debate in committee and on the floor about some perceived issues.
Representative Jordan Redmond is a sponsor of House Bill 345, a new attempt to prevent a runaway Medicaid budget. It includes a work requirement for able-bodied adults to stay on the program, working 20 hours a week or volunteering 20 hours a week or participating in a work program for 20 hours a week.
I think we left it broad enough, and we have a lot of carve-outs in there as well, that it should be really attainable for a lot of folks. And I believe that there's so much value in work. I think that it builds the person more than it helps anything else.
Deep in the details, the bill includes budget reduction strategies focusing on limiting program expansion and reducing reimbursement rates, a key to stringent program management.
We need this safety net program in place. We have to have it. We just need to make sure that we're not going to burn it all down while trying to keep this.
Critics appreciate key differences in the latest attempt.
Well, this one isn't a wholesale repeal of Medicaid expansion, so I guess there's that.
But still, lawmakers like Representative Alana Rubel worry that strict reporting requirements from Medicaid users could cost Idahoans their coverage.
It puts in extensive paperwork processing and submission requirements. The upshot of that is people get sideways with the reporting requirement and they end up stripped of their Medicaid coverage.
The problem Rubel sees from there?
If we kick 25,000 people off of Medicaid who are working but just didn't properly process all their paperwork, what's going to happen to those people? We have ended all of the social safety net programs. We've ended the CAT fund, the indigent fund, all of the things that would cover their care.
After House Bill 138 passed the House, there was chatter in the hallways of the Capitol that major stakeholders rushed to push lawmakers to redraft the idea.
Yeah, that's absolutely true. So after we had some momentum on 138, we had a lot of folks, providers, constituency groups come together and say, hey, let's talk about, here's the issues we have. Could we look at this? What does this look like? And so I think that it creates a really good bill.
But are lawmakers listening to Idahoans?
Total disregard of the people's wishes. Yeah, I've said before, some of these folks, it's like they're legislating on the Fifth Avenue principle when Donald Trump said he could shoot somebody on Fifth Avenue and still get reelected. That's kind of what we're seeing here, where they just disregard hundreds and hundreds of people coming in to testify against. If you're going to create a large pool of uninsured people, this could actually put us in a worse position with respect to this population than we were in before we passed Medicaid expansion.
There's nothing in this bill that gets rid of Medicaid expansion as a whole. There's zero in this bill. We want the best bill for the state of Idaho.
So as Brian highlighted a moment ago, technically the previous iteration of the legislation is still alive on the Senate side of the building. Remains to be seen, though, if it would actually be heard in committee. And Brian, as you kind of heard in the conversation there, when I talk to critics of this idea, they tell me that it's better than the provisions that could potentially fully repeal Medicaid. However, there are still questions on both sides of the aisle about the federal investment. So if you didn't know this, Medicaid, for example, is paid for 90% by the federal government.
Right.
If that contribution were to ever change, it would vastly change how Idaho handles the program. So there are provisions in this new legislation on how to handle something like that. It has been pointed out, though, that Republican states, red states, they actually utilize Medicaid at a higher rate than blue states. So it would be interesting to see if the Trump administration or Congress would take action.
It's interesting also, as Representative Redmond pointed out with 138, that this was all about accountability, but we've had several people text in that, wait, they want accountability for medical care, but not when it comes to private school education. So it's kind of a, yeah. All right, thanks, Joe.